Hi, everyone. This is Dr. Tami Patzer, and this is Relief Now Laser Method sponsoring Optimal Health. And today, my guest is Dr. Ben Smith of Hoover Spine and Relief Now Laser Birmingham. So, we're just going to have a nice conversation talking about laser and how it may be able to help you with some of your needs. So let me tell you a little bit about Dr. Smith. He is from Birmingham, Alabama, where he attended the University of Alabama at Birmingham for his undergraduate degree in exercise science. And then he obtained his chiropractic degree from Texas College of Chiropractic, and he chose exercise science as a pre-professional degree because he had planned on going into physical therapy. And at that time, he actually was playing rugby for the Birmingham Balkans. And in the second season, guess what? He started to have back pain and other issues. And as the pain persisted, guess what he turned to? Chiropractic. So he actually ended up going to the chiropractic school so that he could help other people. So now, fast forward, 20 years have gone by, and he has been focusing on restoring the function to the spine and joints of patients so that they can have the freedom to perform their daily activities and any other activities that they'd like to do. So with that, doctor, I'd like you to tell me a little bit more about your background and why you decided that laser therapy was something that you wanted to add to your practice.
Yeah, so as you mentioned, I've been practicing for 20 years. About 10 years ago, really more like 12, um, I had this rash of arthritic knees that came into my clinic. And we just discovered we didn't have a good answer. I mean, we just did not. So that took me to the research, it took me to the market and looking around at the various options that would be available to us. Um, and the research with class 4 laser was just unbelievable, even at that time. There was so much research you could put your hands on that validated that the laser was working and working well in many conditions, but specifically for the knees. Um, and so I just kind of continued to watch that for the next several years because we didn't have as many knees coming in. But we found that it was going to help with neuropathy, rotator cuff issues. And all of this was in research that I was just kind of following. And so finally in March of 2020, I invested quite significantly in a Summit P4 class 4 laser. And the very next week, COVID hit. So um, it was a interesting time to say the least, but we have never looked back. And we have recently decided to open up a laser only side to our clinic. It's going to be a kind of a separate thing where we're really going to go after those patients who may not necessarily come to a chiropractic office, but are looking for alternatives that would keep them from surgery or, medications, or they just like to get back to things in their life that they can't do anymore because of these particular conditions.
Well, I think that with the laser, one of the main things about it is it's drug free and it might help people avoid surgery of some sort also. And so I think that's really important. So, what are your specific specializations?
So currently I am uh, AIMLA, American Institute of Medical Lasers practitioners, certified. And it's a very unique course. There are no certifications to have to do laser. There are many lasers on the market. Not all lasers are created equal. Anything below class 4 does not have the research to validate its healing properties. Now, that being said, all laser above a class 3 is going to have healing properties. It's just they're not going to be able to apply that laser long enough to that patient and continue to do some of the other things that they do for that healing property to properly take hold. So with the AIMLA, we're getting well versed in the physics and the science behind what's really going on. And that has been just fabulous to learn and be able to share with patients, because as you know, part of the healing process is understanding what it is that you're doing. And if they can understand it, then their mind can be wrapped around the fact that this can heal. And that just is a tremendous step for patients.
That's really interesting that you say that, because I am one of those patients that the more I know about it, the more I think I can help my own recovery process. Because like you said, when you actually understand what's going on, that can really be useful. So can you talk a little bit more about how laser therapy actually works on the body?
Yeah, absolutely. So the class 4 laser is actually a surgical powered laser, meaning it's 25 watts, roughly, depending on which brand you pick. The difference between a surgical laser that acts like a scalpel and the class 4 laser that we'd use is the handpiece. The handpiece is what either converges the laser or diverges or separates it out. And our handpiece separates it out so that it actually passes through the skin and enters the tissues as light energy. That light energy is in the form of a photon, okay? And photons then get deep into the tissue and get absorbed at the cellular level at what's called a chromophore. And there are many different chemicals that make up a chromophore that will, interact with light. But specifically, they're on the cellular membrane and at the mitochondria. And so this interaction creates a photochemical reaction very similar to photosynthesis in a plant that stimulates energy production. And part of what's going on when you have an injury, an ailment, a condition, whatever, is the cellular metabolism goes way down in those areas. The cells themselves become sickly. When we get that energy flow up, we're going to bring that metabolism of those cells back to normal and allow them to kind of move through their own process 30 to 50% faster. So what that means is a cell's going to divide faster, which is all a cell does. But one cell becomes two, two becomes four. And what that means is you're going to get new tissue healing. It's also going to stimulate vasodilation in the area significantly, which is tremendous because now we're going to have more blood flow coming in, which is going to bring more healing nutrients. It's going to bring oxygen, all of which is going to stimulate the activity to move faster, and we get tissue healing. In addition to all that, it will stimulate analgesics, endorphin release in your body, and several other things that will help with the pain side of it. But our focus has obviously been on, we want you to heal. So that's kind of why I talk more about that.
So basically the laser is putting a lot of energy into the damage, and it gives the cells the ability to do what they're supposed to do, reproduce and create new tissue, healthy tissue. And analgesic is pain relief. Am I right?
That's correct.
And so you get the pain relief, because I know I have a shoulder injury, and I know the pain is what stops me from using it, you know,
Yes.
from that process. So I can understand how having that pain relief and having that energy. About how long would you say it takes to get any type of relief from class 4 laser?
So typically we're going to recommend we start with a baseline of 6 visits. A visit could last anywhere from 5 to 15 or even as high as 22 minutes, depending on the condition that we're treating. Some conditions are more in detail and they require more laser to multiple body parts, where there's others you might be specifically right on the area of complaint. And that the effects of that laser will last for about 24 hours. And many patients will feel almost instantaneous relief immediately. A lot of it has to do with the heating effect of the laser, which is going to be therapeutic in itself. But 6 visits is where we find it's not really a cut line, but where we find we now have enough to see that this therapy is going to work for this patient, and a good baseline to determine how much more we need from an exam at that point.
So can you would these 6 visits be like once a week, or how often, or what would be realistic in terms of how often would those 6 how much time would be between those 6 visits?
So at least a day. We want to get a real picture of what's going on with this patient and the treatment that they're getting. So typically I'll go at least twice a week for 3 weeks, but on a more severe case, we might go, every other day, where we're going 3 times in a week for 2 weeks, because, we want to make sure that we're getting that accurate picture. But in general, 2 to 3 weeks would be your first 6 visits. And then depending on how we have to distribute out the remaining lasers, 2 months, 6 weeks, depending on those types of factors.
So you mentioned that you actually got interested in the laser therapy because you had patients coming in with the knee issues. Do you have any little anecdotes about what some of your patients and how the laser affected their knees?
Yeah, I've got a patient right now that came to me after a soccer match with a torn MCL, and he said, I got a match in 4 weeks and I want to play. And so he is going to finish his 6th visit tomorrow, and he's already confirmed to me that he feels like he can play. He's going to see his orthopedic at the end of this week to get his blessing, but he's already told me we're going to finish this out, and he's playing. So we're going to get him started on his 2nd round, and then we're going to kind of devise that based on a little bit before you go play, and probably a lot of it after you go play, because we anticipate that he will probably re-injure that to some extent. We're not terribly worried about that because he does play goalie, and there is a lot of lateral movement there, but it's that lateral with forward movement that really is what would concern you with that meniscus or MCL.
So he's, and what interested me was the fact that you said he's going to go see his orthopedist. So you work in conjunction with other medical professionals to make sure that everything is, going right with each patient. It sounds.
Yeah, we do. We try to co-manage as much as possible for 2 reasons. One, not every condition is going to respond to the laser. Okay. So we need somebody who's there to help us, that we can trust and we can feel comfortable sending our patients to, that they're going to get the same type of approach that we take, that is going to be as conservative as possible to least conservative. And the other reason is, when a patient comes in and they've got torn ligaments in their knee, they're automatically thinking, I've got to go see the orthopedist. This is an orthopedic only condition. So we want patients to be comfortable in that realm. So that takes some onboarding with the orthopedist or the general practitioner or whomever it is that that patient has their faith in, so that they can have faith in us and confidence in what we're doing, to give that patient enough time to see that this is working. And it's a process, but yes, we do co-manage those in many cases.
So with your different patients, what you said that you didn't see as many arthritic knees as you did back in the day. What are people coming in now to see you about when they're asking about laser therapy? What types of conditions are you seeing more of now that made you decide that you're actually opening up this totally separate laser center?
So we are seeing a bunch of knees now since we got the laser and started trying to push the laser. And that has been really good. We always did rotator cuff issues. We do a lot of rehab in my clinic. We have found that we've been able to reduce those rehab visits with those rotator cuff issues by adding the laser to them. We obviously see a lot of spinal issues, herniated disc, degenerative disc. Those have responded really, really well. Again, allowing us to reduce the number of times that we need to see that patient to get them to a stabilization point. And in some cases, patients that we wouldn't be able to get the results with, we've been able to get those results by using the laser. So plantar fasciitis, we've seen a ton of that. Matter of fact, I've got one now. And it has blown his mind that we're actually doing laser in his calf and found a lot of scar tissue in there, which the laser will help break up. He said, I've been to several places and nobody has looked at my calf. And I said, well, this is 90% of all plantar fasciitis is going to come from scar tissue built up in your calf, which is why our laser is designed to do both sides when we're dealing with, or both body parts when we're dealing with a plantar fasciitis patient.
That's important because a lot of times people are thinking my pain is in my foot. Normally, isn't that where the pain from that is?
That's it.
Not thinking, oh, it's being caused from, like you said, my calf muscle having scar tissue or something. And I think that's where you come in because you know the body. So
Right.
you know it's like this could actually be caused by something that isn't even in your foot, because I can imagine there's a lot of different things. Do you see very many people with neuropathy?
Actually, I do. We see quite a few people with neuropathy. We have several studies that show that class 4 laser is 90% successful with peripheral neuropathy. We have seen that in the numbers that we've seen. Matter of fact, I just finished a patient 3 months ago, and he is currently with me for maintenance on his low back issue. And I was talking to him about it, and he said he has not had any pain since we finished with him 3 months ago. And so that has been just tremendous, that addition to our clinic.
Well, the pain is significant when, like I said, I personally have a shoulder injury, and some of the pain that I felt in my arm is like way worse than, I mean, I equated it to childbirth. So that tells you it hurt.
Right.
When you're able to go, man, that hurts more than that. So with the laser technology, you mentioned that there's a lot of scientific research related to the laser therapy. Is there any condition that you think should not be treated by lasers? Are there any things that you need to think about before you seek out laser treatment?
Absolutely. The biggest thing, as we talked about, we're going to ramp up cellular metabolism and a few other things. The biggest thing we can't do is treat an active cancer because we don't want to ramp up the metabolism of those cells. But ironically, I've had 3 patients with cancer come into me. Now, the cancer was not necessarily in the area of complaint. And I got on the phone and started talking to their oncologist. One of them had prostate cancer. One of them had non-Hodgkin's lymphoma. And I'm trying to remember the other one, but it doesn't matter. And all 3 oncologists gave us their blessing. We talked about the treatment protocols. We talked about what the patient on their side was on. And we came up with some ideas that we might need to change up some medications that they were on at the time, because that would be counterproductive to the laser. Or in the case of the prostate cancer, the oncologist had no idea about class 4 laser, but she wasn't worried about it at all. So, there are times when we can do it. We just have to be do our due diligence and follow proper protocols. We cannot do laser directly over a steroid injection that's less than 7 days old, because it will affect the medication. There are things that you have to be careful of. Tattoos, for example, will heat up some tattoos will not. And I don't know why that is. I have not been able to find that out. But there aren't many. As a matter of fact, it has just been proven that we can treat pregnant women with laser, which is a big plus, because, as you know, having gone through childbirth, it can be very painful sometimes, particularly in the spine and pelvis area.
Yeah, the sciatica and
Yeah,
like
yeah,
that.
and that is a great alternative for a pregnant woman who may not be comfortable with the idea of being adjusted,
Yes.
but that calm, gentle laser that only makes you feel good while it's on you, who wouldn't want that? So, there's very little that we cannot do. In fact, I was just following a training today, and the teacher in that says that only the sick cells in the area are going to absorb the laser. The healthy cells won't. So that is some research I'm looking forward to looking into, because that says a lot. There's just not a whole lot that can go wrong with the laser as long as it's done properly.
That is so interesting. I mean, obviously you yourself are really making sure that you have the education and continuing education about the class 4 laser and how it marries into all of the other things that you do. How can people get in contact with you?
So the easiest way, obviously, we have our website, and that's www.reliefnowlaserbirmingham.com. They can call us. It's 205-536-7758. They can email me directly. We are still trying to get the email set up for our laser side. But my current email at my other clinic, and I want to be very clear to people, if you email me and you're interested in the laser, we're not going to try to show you anything else other than what you are interested in seeing, unless you change that interest. So, but that email is drsmith@hooverspine.com.
Okay, Dr. Smith, Dr. Smith at hooverspine.com. And of course, it is reliefnowlaserbirmingham.com. So before I let you go, is there anything you'd like to add?
I think we've covered a lot. I've enjoyed this a lot. I will say this, for anybody who's watching this show or listening to the show, if you mention Dr. Tami's show, we're going to offer you a free consultation, and your first laser is free to try this out. See if this is a good fit for you. We certainly don't want anybody under care that doesn't feel like they're getting their relief. And we totally understand that new technologies can be a little bit daunting, and we're gonna help walk you through that as much as we can. And if you do all that and you feel like this is not for you, then at least you've tried. But we will be offering that for anybody who mentions this show, and that they saw us here.
Great. Well, I appreciate that. So everyone, remember optimal health, Dr. Tami, anything you say will be acknowledged, and why not get that consultation and your first laser appointment at no charge? That's just a really nice thing to happen. So Dr. Smith, I really appreciate it. And I learned a lot today. I really enjoy learning about all of the different things directly from a doctor who's practicing this every single day. I learned a lot from you today. So everyone, this is Dr. Tami Patzer, Optimal Health. My guest has been Dr. Ben Smith, and this has been sponsored by Relief Now Laser Methods. Thank you.